the first of anything can bring about anxieties and fears. This is especially true when beginning a new therapeutic relationship. What exactly happens during that first initial play therapy session intake? Keep watching to find out. Hi, and welcome to my channel. I'm Kim Feeney with Butterfly Beginnings Counseling. I'm a licensed independent social worker and a registered play therapist supervisor. For the past 10 years, I have been helping children and families lead healthier emotional lives. Does this sound like something you might want for your family? Then please consider subscribing and hit the bell for weekly notifications on the latest content. We have gone through quite the journey over the past few weeks. We have determined if play therapy was right for your child, found a registered play therapist, and explained play therapy to your child. If you missed any of these videos or you need a recap, you can find the links above or below in the description. Now it's here. Our intake session is scheduled. While each therapist's procedures will vary for an intake by individual and practice, there are some general things that we cannot expect. Paperwork. Most therapists will provide you with the intake paperwork electronically to complete before the session. This paperwork will include things like a consent to allow your child to participate in play therapy, HIPAA privacy practices and laws, and mandatory reporting information. It should also include policies and procedures specific to the practice and the therapist, explaining things such as communication, scheduling, and billing. If you have any questions or concerns regarding the paperwork in any way, please bring them to your therapist's attention. It is very important that you understand the papers that you are signing. If you're looking for or interested in other parents' experiences of play therapy intakes and play therapy, consider joining our Facebook group for calm, empathetic, supportive parents and caregivers with the link below in the description. Building a therapeutic rapport with a therapist is just as important for you as it is for your child. During the intake, it is your opportunity to begin building this relationship. Again, for most therapists, this will be a one-on-one session without the child present. This allows for open communication about current struggles, issues, concerns. I encourage you to be completely honest with the therapist about what you feel and see the issues being. The more details and examples you can provide, the more accurate the treatment plan can be. During the intake process, the therapist will ask you questions concerning your child's history, possibly even before birth. Depending on the therapist, they may even ask you questions about your childhood and family growing up. These questions assist the therapist in forming a whole picture about your child and family. They will ask questions regarding the child's school and home life, how discipline is like in your family, how they relate to siblings and peers, and other adults and extended family members. During the intake session, the therapist will explain what will happen next. They will discuss things such as meeting your child, how sessions will be structured, when and how often communication with you will occur. This is another opportunity to ask any questions you may have about the play therapy process. If you have any questions about the play therapy process now, go ahead and drop them below in the comments, and I'll do my best to answer. Some therapists also like to set treatment plan goals during the intake session, while others prefer to do this later in a parent consultation. Your input is essential to this process, as your observation will help to establish future progress towards goals. While this is a lot of information to cover in the first session, this will provide the groundwork and structure for your child's play therapy journey. Don't forget to join us over in the Facebook group, Calm, Empathetic, Supportive Parents and Caregivers, using the link below in the description. If you found this video helpful, please give it a thumbs up, subscribe, and share it with a friend. Here are some other videos you may also enjoy. Thank you for watching, and wherever you are in your day, hug your child and make it a great one.